everyone. Thanks for joining. We're going to get started now. Just a reminder, we have 30 minutes, one question, one follow-up. Today we... Hi everyone, thanks for joining. We're going to get started now. Just a reminder, we have 30 minutes, one question, one follow-up. Today we have Dr. Yaffe and Dr. Heyer here today, so I'll turn it over to them for some brief remarks.
Thanks very much. Good afternoon, everybody. I'm pleased to be joined today by Dr. Dirk Heyer, who is the COVID-19 Vaccine Distribution Task Force member and also coordinator of the Provincial Outbreak Response. We have not had an update since last Thursday, so I will be providing a review of the data over the last week, and I will offer Dr. Heyer the opportunity to provide some additional comments or remarks at the end of my time. Unfortunately, our situation is dire, and the numbers I'm about to report will reflect that. Since our last update a week ago, Ontario has reported an additional 29,459 cases of COVID-19. That brings our 7-day average of daily cases to 4,208. This is a 36% increase over last week's 7-day average, which was 3,093 cases per day. Ontario has reported over 4,000 daily new cases for 5 of the last 7 days. And today, we are reporting the highest number of cases we have ever seen in a single day at 4,736. Our previous daily high was only 4 days ago when we reported 4,456 cases. Our provincial cases rate has also increased by almost 32% this past week. And now it's at 160.6 cases per 100,000 people. And very sadly, we are reporting an additional 145 deaths since last week's update. We do extend our deepest sympathies to the families, friends, and caregivers of those who have passed away from COVID-19, and to all those who are mourning the death of a loved one in these very difficult times. Hospitalizations and ICU occupancy are at the highest levels since the start of the pandemic. Today, we have 1,932 people in hospital with COVID-19, including 659 who are in intensive care. In terms of testing, 65,559 tests were processed yesterday, with a positivity rate of 8%. And that is the same as our current 7-day average for percent positivity. On Tuesday, Ontario recorded our highest positivity rate since the beginning of the pandemic at 10.3%. We've had a total of 27,564 confirmed cases of the variants of concern, or VOCs, in Ontario. 99% of these are the B117 variant, which was first identified in the UK, the United Kingdom. The 7-day rolling average positivity for these variants of concern is 69.1% of all cases, slightly up from 67.9% 1 week ago. I really wish that I had better news to give you today. These data are alarming and should be of tremendous concern for everyone. I have been providing updates to Ontarians for over a year now, and at some of the previous press conferences, I referred to the situation as worrisome and even scary. What is truly scary is that when I used those words before, our rates and our trends were nowhere near where we find ourselves today. And it is likely we will see our daily cases remain high for the next while, and the number of people in hospital and intensive care will increase even more. While we have a stay-at-home order and stronger public health measures in place, it will take some time before we see the effect of these interventions. But we do know that those measures work. We know that by reducing mobility, by staying home as much as possible, and by limiting social interactions to those within your household, our rates of transmission will begin to go down and people's lives will be saved. I do want to acknowledge the great progress that is being made with respect to immunization, but of course more vaccines and more time are required before this will have the desired impact of lowering illness and death. That is why it is the actions and choices that each of us make right now, tomorrow, and in the weeks to come that will make the difference. While our incredible healthcare workers continue to vaccinate as many people as possible, as quickly as possible, we must all do everything we can to limit transmission, take the pressure off our hospitals, and allow more time to roll out our vaccine plan. I'm going to turn it over to Dr. Heyer now for some remarks.
Thank you, Dr. Yaffe. And as I listen and as I look and read the numbers and hear from those, I think of those people who are sick at home, isolating with positive tests. I think of those who went to hospital, were evaluated, and returned home with their families and having difficulty potentially worrying about spreading to their families or others. I think of those who go out to work and put themselves into positions where they may be at risk. I think of those in the hospital. I think of those in the ICU by themselves, sometimes being transferred to various places across this province because we have such a limited number of beds right now. And I think of those who have lost their lives. It's really tragic, and it's really hard to be in those situations for sure. We, working with the vaccine, are trying to race against that. We can't win that race this month. These numbers aren't going to be stopped by the vaccine, but we need to be taking all of the steps that we can to provide vaccine as quickly as we receive them, as quickly as we can, in areas of those people that are at risk themselves for individual factors, and also areas where people may be living or residing, which are also identified at risk. And that speaks to the hotspot work that the public health units across the province are working together with the province to provide vaccine as quickly as possible. And those hotspots were picked and developed and identified using a number of different sources of data. One of the key sources of data was analysis that was done with the number of cases, the number of hospitalizations, and the illness burden related to the postal code where people lived. That work was done by a variety of people, but specifically the science table did significant work to help to identify where there were areas of greater risk and why there was greater risk within those areas, and published and released information which was very valuable to the province to helping to decide which of those areas would be focused in the hotspots. There were other things that were considered, and that was where that hotspot was within a ranking of severity, but also other considerations such as ethnic consideration and ethnic concentration and material deprivation, because there are also populations within the province that have been disproportionately affected, not only by where they live, but who they are. And so those are Black and racialized populations, as well as other ethnic concentrations that are in different locations within the province. There also was, earlier in the fall, a direction that the province took in working together with testing positivity, with case rates, and testing that was not occurring in the same frequency that was occurring in other parts of the province. And that was part of the high-risk priority work that was done in the fall to help to provide greater access to testing, greater access to more services to help to support, again, those that were disproportionately affected. All of those factors were considered in developing the hotspots. And these were developed based upon data that showed ongoing historic increased rates and increased burden of illness, of hospitalizations, illness, and death within those locations. Now, postal codes are big, and some of the postal codes will have significant areas of greater disproportionately affected compared to others. We recognize that, and we recognize that at times may be focus of people's attention drawn away from the area of high risk to move to those areas that may not be of such significant risk within that postal code. We looked at this in the best way possible, in the most practical way, to be able to provide advice about where to focus on greatest risk, greatest target, greatest burden to protect those in the greatest need. So all of this work is going on. The other piece within the vaccines that I wanted to mention, and I frequently hear about, is the vaccines that are in fridges, the vaccines that are in freezers. We receive vaccines on a semi-regular. Some of them come weekly, some of them come at different intervals, and those are allocated and delivered and planned for clinics over the period of time within that period that those vaccines are available. So if we receive 300,000, we give 100,000 per day right now. We won't give all 300,000 in the first day. We will have clinics booked out to be able to allow scheduling, to have people to make plans, to be able to come. And so there are bookings that put people into place. But all of the vaccines that we receive in the province are rapidly allocated to other locations across the province for delivery, and then those delivery mechanisms will occur. The mass clinics will be somewhat faster because there's a greater turnover and speed through, and those in targeted areas that may be different channels such as mobile delivery, pop-up tents and others may not have the same speed, but they have significant impact. So the two are working together in different channels, and that can have different speeds, and other channels may have also different speeds of delivery. But what I can say is that vaccines don't sit around. They don't rest in provincial freezers or coolers on a basis. They're allocated out, and they are their appointments booked for weeks out to be able to provide vaccine to others. So I'll pass over for questions at this point.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
First question comes from David Woodard with Global News Radio.
Good afternoon. If new restrictions are introduced tomorrow or in the days ahead, what could some of them entail? And how do you expect further restrictions to limit daily case counts? Because as of now, it seems the restrictions we've seen brought in just haven't worked.
Thank you for the question. As we know, putting a restriction in, let's say today, we won't see the impact of that for 2 to 3 weeks at least. And there are a variety of reasons for that. First of all, the infection itself, we know that the incubation period, if you're exposed today, you can become ill within up to 14 days. So then once you become ill, you have to get tested, end up in the statistics and the numbers. So there is automatically a delay between when the intervention is done and the impact is seen. In terms of what more could be done, I know that we're working very hard with the Science Table, Public Health Ontario and others on other potential measures. But what I would like to say right now is that the most important thing right now for everyone is to be aware of the measures currently in place and do your best to stay within them. Get your vaccine when you're able to. Stay home as much as possible. Don't mix with people not in your household. Wear a mask. All those things. Don't go out if you're sick. Get tested if you develop symptoms. If more measures come in, they will also need compliance. So it's fine to put in a measure, but we have to have people take them seriously and comply with them.
I think just listening to your question at the start, you're suggesting that they don't work. We, in fact, don't know that they don't work. What we know is that the number today is 4,736. What we can't say is what the number might have been had we not moved forward with some of the measures that we have added over the past period of time. So I think it's difficult always to know what is success. Obviously, success would be people not in the intensive care unit, people not dying, and people not being sick. But it could be that these measures have still had an impact to at least bringing us down to this already horrible number that we're at.
Follow up?
Yes, thank you. And, to that point, we haven't, I shouldn't say it's had no impact whatsoever. It's had not the impact that we've hoped. So what is the hope that increasing restrictions are going to help any more than these restrictions already in place?
Well, I think we have to remember that we're dealing with, in a way, multiple epidemics here, multiple pandemics. We're dealing with the COVID-19 virus that caused the first and second waves, which is coming under quite good control. But we're also dealing with the variants of concern. So, and we know they're more transmissible. Certainly for the B117, we know it's more virulent. And, those are the big concerns right now. They're comprising a bigger and bigger percentage of the cases right now, almost 70%. But we do know that the same measures that work for the original virus will work for these viruses. It's just the measures have to be done very, very well. So whatever we put in place needs to be done very, very well. And, it's interesting. I was thinking about what Dr. Heyer said about we don't know how many more cases we've prevented. And this is very typical of public health. I've been in public health a long time. And it's very hard for people to understand what's been prevented. What they see is what's happening, but how much worse things could have been. It's bad. It's very bad, and we need to make it better, but it could have been worse, and we need to keep working at it, all of us.
And I think your point is so solid, and it's such a real question, and all of us wish we had those answers. I think I've learned so much from Dr. Yaffe and Dr. Williams over the past number of months, but if we knew those answers, we would have the solutions, and all of us are struggling with that. And I think sometimes people don't necessarily hear the measures and act on those measures because they may not have known someone who is sick. They may not have felt the seriousness of this impact on many families and many communities. But we're all impacted by this simply by the seriousness of the infections, the limitations in healthcare that's being provided right now, the fact that we're all in a lockdown situation. All of us are being affected by this, and it has negative effects in many different ways. So as we can take our thoughtful approach in whatever way we can to recognize the risk that we may be putting ourselves in, but also importantly putting others in and the impact of the decisions that we make, those are important things to think through. I understand how people go out. I understand how people don't necessarily recognize the significance of all of this, but it is so important that we tackle this and bring this down in a way that will allow our healthcare system to return to function, our public health system to return to function, and then our society to get back as we continue to vaccinate through all of this process.
Next question.
From colleague Cote with Radio Canada.
Hi, guys. I was just wondering, can you comment on the new delay of Moderna vaccines? We had a shipment supposed to arrive on April 26th. Now it's supposed to arrive on May 3rd. Can you tell me how it will affect, the vaccine rollout and why is it delayed,
Thanks for that question. And if we had the answers for the delay, again, it would be, it is unfortunately out of our control, both the federal control as well as the provincial control, from my understanding. And I don't have specific insight into why the delay is. It clearly impacts because the quicker we have vaccines, the quicker we can provide those vaccines to others. And the public health units, the hospitals, bookings have been booked out for a number of weeks, and it leads to the fact that we don't have the vaccine to give on those when we were anticipating that to come. So that leads to clinics being canceled or rebooked. It's frustrating for people. It leaves people continuing to be without vaccines. And as you know, vaccine provides protection to those, especially those who are vulnerable to this illness, and we want to provide that as quickly as possible. So it is very difficult. The Pfizer dose, you recall early on in the vaccination process, we struggled with Pfizer doses and delivery being reduced. That has been much more regularized. Well, it has been regularized over the past number of weeks, and those clinics are scheduled on a regular basis as we proceed forward with that. Again, when you have a change in schedule of delivery, it means a change in everything else that we're doing. The timing, the clinics, who gets it and when they get it. So it is quite challenging. And my hat goes off to the public health units who are just working so hard in so many different ways, and also to those in the hospitals and other clinics that are working together to be able to respond in a nimble way to these ever-changing delivering schedules, which are very tough.
Follow-up?
All right, my other question regarding the potential new restrictions. It's been 1 week since the last ones have been in place, the new restrictions. I know it's super important that people keep following them, but is the public health, you guys, pushing for new measures like offering those advices to the cabinet, or what's the situation for you guys on that aspect?
Yes, for sure. We were taking the advice of the Science Table, Public Health Ontario, and other experts around what evidence there is around potential effective measures that have not been taken yet, that changes that perhaps could be of benefit, looking at what other jurisdictions have done. So I understand a variety of options are being considered, but the specifics are not available at this point. Once decisions are made, they will come out.
Next question.
From Cynthia Mulligan with City News.
Hello. I was wondering if you have a sense of where the spread is coming from. Is it workplaces? Is it non-compliance? What is the data telling you about where the outbreaks are, and what restrictions could potentially address them?
I will start. Maybe Dr. Heyer will add. We certainly get data every day about the new outbreaks and where they're located. And at this point, the good news is we have less in long-term care and retirement homes. They've been highly immunized, in particular the residents, and at this point it's looking much better. Still definitely need to be monitored and have measures in place. We are getting continuing to have outbreaks in workplaces. We still get reports from schools, childcare centers, group homes, and other settings. So it tends to be where people congregate, obviously. And the transmission, the most common source for transmission is a contact with another person, particularly in a household. So if you've got a household where it's hard to isolate, there's a lot of people living in a crowded house, this, particularly now with the variants of concern, they do spread extremely easily between people.
So while we do see a significant number of outbreaks, and there were 66 reported today, there were approximately over the 7 days prior about 140 and about 1,450 over the 30 days. Outbreaks are not the primary source of the number of cases. Outbreaks represent a smaller proportion of the number of cases all around, and as Dr. Yaffe said, lots of spread within the community and amongst those who are in close contact with each other. So the outbreaks are spread across different organizations, but many of those are from people who are coming into those settings and then bringing that infection into the setting. I'm not not being critical of the people because they are infected and they are doing what they may need to be doing and not recognizing that they have the infection when they attend those different settings. So it's not so much the outbreak per se, it's the congregating, it's the gathering, it's the people being together potentially in social situations or in other situations where they can't be masked and can't be in positions or aren't following those steps.
Follow up?
I guess what I'm looking for is, do you have a sense of non-compliance? Is non-compliance driving this? I know earlier the Solicitor General was saying people aren't always following the rules. So is it 20% non-compliance, 40%? Do you have any sense of that? I know in the Muskoka area, they have blamed some outbreaks on bush parties, for example.
I was just briefed yesterday about the preliminary results of a behavioral survey that was done of a sample of the public in Ontario, and the vast majority are complying very well. There's a smaller group that is complying most of the time, and there's a very small proportion who are not complying. And I think if you think about yourself and people you know, I think most people are really trying to comply, but sometimes they let it slip. They think, well, I know these people, and I know they're okay, so it's okay to sit with them. But, they're not in my household, but as long as I just, I've even heard people say, well, as long as I face forward and they face forward, it's not an issue. But it is an issue. I mean, this thing travels through, if you cough or even just breathing or speaking, droplets are coming out of your mouth, and they will travel. Certainly, we're looking at 2 meters. Small particles, maybe further as aerosols, and they will infect other people. And to keep in mind that not everyone who gets this infection has symptoms. Some people have no symptoms, or they're pre-symptomatic, or they just don't realize they have symptoms. So just the fact that you're feeling well does not mean that you don't need to take precautions. I think the vast majority of people are really doing their best, but we have to just be very cognizant of all the things we're doing.
I think it's very difficult to know what would be described as non-compliance. We don't have a measurement. We're not out there counting or doing those sorts of things. But I think you can look around and think about the things that you observe on a day-to-day basis. And there are certainly people that need to be out. And those are people that are working to support themselves, but also to support all of us working in a way that we can continue to function in our best way possible at a tough time. But look out at traffic jams. Look out at the amount of traffic that may be present. We have a stay-at-home order right now. And people, there's traffic jams, there's stoplights that are backed up. Absolutely, people should be out and getting some exercise and getting fresh air and being outside, not disputing that. And I think sometimes people get confused about getting some exercise and getting out and getting for a walk or a bike ride or a run or whatever it may be, getting outside from being okay to go outside. So I think take a look around, see what you see, observe what you observe, and that'll give you an idea of the steps that people are taking. And important that everybody thinks about what they're doing and the potential risk that they're taking, as Dr. Yaffe said, and potential risk they may be putting other people into. Some have to do what they have to do, and we understand that, and aren't able to put themselves into the same degree of protection of others, and all of us need to think to be able to support them as well.
Last question.
From Rob Ferguson with the Toronto Star.
Hi, Doctor. Sorry about that. I'm slow to change my mute. Dr. Heyer was saying at the start that we won't win the race on vaccinations this month, and I don't think anyone is surprised by that. But I'm just wondering what you see coming forward. I'm assuming both of you have seen the modeling that's going to come out tomorrow, so I wondered if you could share with us some more detail on how this is shaping up.
I'll start, then Dr. Heyer will add for sure. I think the bottom line is things are not going to get better. If we don't change what we're doing, things will in fact get worse. So That's the bottom line. We do need to be really careful. And if you think about it, remember what things were like last spring when we had the stay-at-home order and what the streets were like. They were pretty much empty. They're not empty these days. We have to go back to that. We have to think about it the way we did then. And I know that people are tired, people are fed up, but we want to get this thing controlled, and we don't want to ruin the summer. So we just need to do our best. I'm sure Dr. Heyer will add.
Hey, Rob, thanks for the question. I think you can probably hear it in our voices and see it in the numbers. It's a really tough time.
Follow-up, and this is the last question.
Thanks, doctor. Just following up on that. So last spring, there was a lot more shut down. So do we need, I think I just heard Dr. Yaffe saying we pretty much need to go back to that. So can you give us a little bit more detail on what is still open now that was closed then?
I can't really go through all the details, but I think people just need to remember what the streets were like. And whether something is open or not open is one factor. The bottom line is that you don't need to go there. If you can stay home, if it's not something essential, obviously there are certain situations, as Dr. Heyer said, where people have no choice. But if you can work at home, if you can, you don't need to go shopping for food every single day. Medication. Try and minimize the amount of time you're out other than for exercise. And when you're exercising, I would say try and do it with people you live with, unless you live alone and then with the household that you share. So whatever decisions are made with respect to what's open or what closed, certainly those are important, but what's most important is what you decide to do in your own life.
Thanks, everyone.